Hello, beautiful people, and welcome to the HumanizeHer podcast. I'm your host, Erica Lockheimer.
And I'm your co-host, Elizabeth.
On this episode of HumanizeHer, we're joined by Joanna Strober, CEO and founder of Midi Health, and a woman who's redefining what healthcare looks like for women in perimenopause and menopause. Before Midi, Joanna built a remarkable career as a corporate leader, investor, and entrepreneur, launching companies and backing transformative innovations. But her mission began with something very personal, searching for answers to her own midlife symptoms. She discovered a system that was fragmented, under-researched, and often dismissive of women in perimenopause and menopause. So she asked the bold question, why aren't there better answers for women like me? And then, when the system couldn't deliver, she built it. Today, Midi is the nation's largest virtual care platform for midlife women, addressing everything from sleep and brain fog to bone, heart, and sexual health, with both hormone and non-hormone options. With innovation, compassion, and a fearless mission to shatter the stigma around menopause, Joanna Strober is changing healthcare. This episode of HumanizeHer is brought to you by BitGo. Just like we believe every woman deserves the tools to thrive, BitGo believes every business deserves the digital asset infrastructure to scale. Because digital represents more accessibility, more transparency, and more possibilities for everyone. Thank you, BitGo, for sponsoring Women's Voices. Welcome, Joanna Strober, to the HumanizeHer podcast. We're so excited to have you here today. Thank you for coming and driving over here.
Oh, thank you. I'm excited about this.
This is a very, very important subject. So menopause, perimenopause, and when I heard about Midi Health, I'm also a huge fan. I'm a user of your product for the last year and a half. Changed my life. So thank you for creating this company. It's amazing. You're the founder and CEO. How long has Midi Health been around so far?
We've been serving patients for 3 years.
3 years? Okay.
Baby.
Yeah, but no,
exactly.
the growth is like super, hyper. I remember being with some of my girlfriends I was telling you earlier, and we were complaining about, oh, I can't sleep, or I'm having these challenges in our hormones. And it would be great if we can talk about like what menopause is, perimenopause. But one thing that they definitely told me was like, check out Midi Health. And to my surprise, I was always used to going to an OBGYN appointment, getting that appointment maybe take 3 months, 6 months. I was able to get an appointment in 1 to 2 weeks.
Yeah, that's our goal.
Well, you did it. So
Yay.
thank you. I was like sleeping better really fast. So thank you.
Yay.
Yeah, if we can talk about some of the basics, because I don't even know if people know what the difference is.
Yeah, so what is so interesting is that women's health is very much related to our hormones. And there's this concept of we have our period, right? And that's like a hormonal event, honestly. When you have a child, that's ending up being a hormonal event. And then there's this concept of menopause, perimenopause. What does that mean? All that it means is that your estrogen, which goes like this, is fluctuating and fluctuating and going down and going down and down. Eventually, you stop having a period. That's menopause.
Okay.
Menopause just means you stopped having a period for a year. That's all it means. But perimenopause is insidious. It starts in your 30s. It starts in your 40s. It is just those estrogen fluctuations and the estrogen going down. And that is what causes chaos in our bodies. And that is what causes us to not sleep, to get angry, to have hot flashes, to have joint pain, to actually have our hair start to thin, to have our face start to get, the skin start to get thinner. It is all related. And our estrogen is the most powerful thing in our body. And as it goes down and fluctuates, that's when women's health changes. Wow. So what I have learned is that everything almost in women's health, other than like breaking your leg, is related to hormones.
Wow.
And so the exciting thing is now there's emerging research that can tell us what do you do about these changing hormones and what can we do to stay healthy as we get older. And then the other thing I really want to say, and we should talk more about this, is you are never done with menopause. So I was on a plane and a lady comes to me and I'm wearing my shirt that says menopause is hot. And she's like,
I saw that picture.
Yeah.
It's so great.
It's so great. But she's like, oh, I'm done with that. I'm like, no. It still is going down. And so those hormonal fluctuations are actually forever. And so menopause, there's premenopause, perimenopause, menopause, and post-menopause.
Oh.
And it's all the same thing. It's all just estrogen and hormone fluctuations. And there's things you can do when you're in your 30s, 40s, 50s, 60s, and 80s.
So is it a curve with estrogen that just keeps on going down over time? Or are you saying it is that fluctuation like even forever for the rest of your life?
No. At some point, you hit menopause and then it's just low. The estrogen is low. And there's things you can do to bring it higher.
Okay.
Gotcha.
Wow.
But it's about understanding the stages that you're in and how to act on it.
Yes, exactly.
So I have a personal question. How do you know that for a woman that's maybe taking birth control or not having a period or on an IUD, you don't have your period?
That's right.
Yeah,
So
like
how
I
do you
haven't.
know that you're in menopause or not? Like how do you know?
So actually the really interesting thing is that if you're taking a birth control, that is hormones.
Okay.
So it actually doesn't really matter what you know, if that makes sense. It doesn't matter to know if you are in perimenopause or menopause.
Okay.
What matters is how are you feeling? What symptoms are you having? And can we treat those symptoms?
Got it.
And the reason this is actually really important is that birth control is actually 3 to 5x stronger than hormone replacement therapy for women. It's the same hormones, much, much stronger, designed to help you not get pregnant, right? But actually a lower dose of hormones is better for menopause symptoms. So if you're willing to use a different kind of birth control, then it actually makes a ton of sense to go on hormone replacement therapy that's designed for menopause as opposed to the birth control pills that are stronger.
Okay.
But you can still experience the symptoms of perimenopause, even if, like how she mentioned, IUD. I haven't had my period in probably 8 years, right?
Thank
So
goodness
how
for
would I
me.
know? I know it's been great. No tampons for me in my house, but yeah, can you still experience those symptoms and notice that something's changing in your body?
You can.
Okay.
And so if you're experiencing that, it might be that the hormone birth control that you are on is not well calibrated to menopause or perimenopause.
Got it. Oh, interesting.
And I can speak from my own experience, and I'm sure you have your own, Joanna, but I started doing the estrogen patch thanks to your service, and it made a huge difference of how I was feeling. And then I recently added on progesterone, and now I'm sleeping like a baby, which is so nice. But that's another element of doing those two different type of hormones. And we should also talk about some people don't do hormones and some people do, but what is the difference with the progesterone and the estrogen, and how do you balance those things out?
Yeah, so if you have a uterus, then you should use both progesterone and estrogen. If you don't have a uterus, then you only need estrogen, but many women sleep better with the progesterone, and so they want it even if they don't need it.
Yeah, it works.
Yes.
I'm out. Yeah.
It's like
beautiful, right?
melatonin or
Yes.
something, just knocks you out.
Yeah. Well, no, it's actually better than melatonin because I've tried melatonin, but I've only recently taken it in the last like several weeks because I had this challenge and I was like, why didn't I do this earlier? And I think that's what we should talk about, some of those challenges too, where how was I not aware of this early on? And here I am like 50 years old and just now trying to, let alone perimenopause that you're going through. Now you're talking about it. I wish I was talking about it at that age, right? So why haven't we talked about it sooner?
Such an interesting question, isn't it? So there's a lot in that question. Part of it is that we don't have enough research on women's health, right? That's a big component of it. We just don't have enough research. But for many years, women were taking hormones. About 45% of women in the country were taking hormones. And then there was a Women's Health Initiative study that came out in 2001 that unnecessarily scared people and made them believe wrongly that taking hormones was related to breast cancer. And that study was misinterpreted. But we all know that fear spreads really fast, right? And so that study wrongly spread fear among women to give them the impression that hormones cause breast cancer. Now, the truth is 25 years later, when we look at that study, we actually see that women who are on estrogen alone actually had a 30% reduction of breast cancer.
Really?
Reduction of breast cancer.
Wow. I did not know that. That's
the
fascinating.
opposite of what they're preaching to
That's right.
everyone.
And so the issue had to do with the progestin, and we don't use that type of progestin anymore. We use a different
That's
type.
different than progesterone.
Testosterone, correct.
Okay.
Yes, that's
That's
right.
confusing.
It's very confusing. No, it is. It's very confusing. So now we have less than 4% of women in the United States in perimenopause and menopause are taking hormones. And so because of this unnecessary fear, it really damaged women's health.
Oh my goodness. And it's almost like, what was that study? Like garbage in, garbage out? Like who did they have these studies for that they were able to come to this conclusion? I mean, is there any
so it wasn't
learnings
garbage.
from there? Yeah.
It wasn't garbage, to be clear. It's a huge study. And this was just one very small component of the study.
I see.
And they were actually testing a correlation between heart disease and hormones. And they used older women. So they used women who were in their 60s instead of younger women. And they got an early response that scared them. And so they reacted how they felt appropriate at the time. I don't know if you follow Dr. P.D. Artia. He says that this is one of the worst malpractice in women's healthcare. Wow. It really did get an entire generation to stop taking hormones and be scared of it. The research that we see now actually is pretty clear that women who take hormones, it's good for your bones, it's good for your cardiovascular health, it's good for your brain health. Like there's a lot of really good benefits to it. So it is very sad that an entire generation of women did not get the right medical care.
Yeah, that is sad.
That's very depressing.
Yeah, it
well,
is.
you're here to change that.
Yes,
which is
exactly.
fascinating. And I love that you mentioned all the benefits as well, because I even learned on the call that it also helps with brain health, like dementia and like all these different things. I had no idea. Yeah.
There's really good emerging evidence that's showing that that there is a correlation between estrogen decreasing and Alzheimer's. So it's early, but it's good enough for me. I'm not going to wait for 30 years until they have established evidence, but it's pretty good evidence.
Is this a prescription or is this an over-the-counter option that people have? And
It is a prescription. It's the patch that we were just talking
It's
about.
literally a little sticky thing that you put on your. I put it on my butt. I think
Yeah.
you could put wherever you want, and then I rotate it.
Me too.
Yeah. Okay. Good. Yeah. That's
You're
the
so
place.
PG, or I'll put it on my...
But then the progesterone is an oral one that I take, but I think I don't know if there's different.
Yeah,
methods.
no, you want to take that oral.
Okay,
Most
good.
people take
Okay,
oral.
so at least I know I'm doing it right. Check.
Yeah.
Thanks. So we're talking about hormones, but not everybody wants to take hormone replacement. Are there alternative methods or things that you recommend through Midi Health that people can do?
Yeah, so absolutely not everyone wants to take hormones. There is also a section of society of people who can't take hormones because they, for example, have breast cancer that's estrogen positive. Those people can't take hormones. So, and there's also people who had a stroke. Like there's certain things and certain people who can't take hormones. So the way that I would think of it is as follows. Estrogen is horizontal. It's systemic. It impacts every part of your body, and it can really actually help, every part of your body feel better. If you cannot or do not want to take that, then we give you vertical solutions. Okay. And there are supplements that you can take, such as black cohosh, which can help with hot flashes, such as magnesium and ashwagandha that can help with relaxing or cortisol management. Or there are also medications that are non-hormonal that you can take. So we have I think of it as an arsenal of options for you. And at Midi, our job is not to tell you what to take. It's just to give you all of your options.
Wow. I like that. And I do like that approach because before I did progesterone to help me sleep, I tried magnesium. And that was a recommendation and it worked, but then the progesterone just worked so much better.
Yes, exactly.
But it was a way to like test it out. And maybe that works for some people and maybe it
Yeah.
doesn't. So I think that's great that you have both methods for people to try.
It's good there's options because it's not a one size fits all.
It is
Every
not.
body is different, right? So based on personal preference, health situations. So that's awesome that you give them, here's what you can do.
Yeah.
That's our job.
Yeah.
Our job is not to tell you what to do. It's to give you options, to tell you all of your options, and then let you decide what you would like to try.
Right. But they can still get the prescriptions through you if they make that choice.
Yeah.
Okay.
Right.
Yeah. And it's covered through insurance, which
Yes.
is what blew my mind. I'm like, I can get service this fast and it's covered by my insurance. I was shocked. I had no idea. Like, Was that a challenge for you to build
It
a
is.
business in that way? I was also curious, like how you were able to do that.
Yeah, it's a huge amount of work. Honestly, there's no other way to say it. It's a lot of work. We have a whole army of people who spend their life getting insurance coverage for us, but we just feel so strongly like our job is to give access to women, not just to people who are rich and can afford a really concierge care, but all women. And in order to do that and be important to society, we needed to get the insurance coverage.
Got it. And you can see Midi Health, a provider, with or without insurance? Does it matter?
That's right. You can do with or without insurance.
Wow.
That's right. 90% of our patients are using insurance.
Are using insurance?
Yeah.
Okay. Yeah. Wow. That's fantastic. So I also want to talk about you personally. I mean, here you are, the founder and CEO of this company. How did this happen? How did you create this idea and actually execute on it? I know it's a big question, but if you can just walk us through that thinking of how you even got there.
Mm-hmm.
I'm old.
No, you are not.
Welcome to the club then, or not?
But I say that I've had a lot of careers. I've been in, working for a long time.
Mm-hmm.
I have had, I think, 5 careers.
Wow.
I've been really fortunate to get to meet really amazing people and get to do really exciting things during my career path. But it's been very much, I guess, like estrogen, fluctuating.
There you go. That's awesome.
So I had founded another company focused on childhood obesity and had sold that to Weight Watchers and was working at Weight Watchers. And I started paying attention to the weight loss industry, the medical weight loss industry, and getting very, very excited about the new weight loss drugs that were coming out. And I decided, and this was way before they were popular, before anyone knew what Ozempic was, honestly.
Or like all the GLP-1s
Yes.
that everybody, okay,
Exactly.
so even back then, okay.
So I got really excited about that. And I started paying attention to whether Weight Watchers should get into that space. And so I did a lot of research to understand how you would set up a national medical clinic and how you would get insurance coverage and how you would get the drugs delivered to people's homes, and put a lot of time into that. And got very excited about it, honestly, and did a huge project. In the end, Weight Watchers said no. It was, they thought it was too risky to get into the medical weight loss space. Now, they have since changed their mind.
Wow.
But I had done all this work and learned that women needed these medications, but they also needed other medications. And I knew that I was taking hormones and how incredible that was for me. So what I realized was that I could take all this work that I had done there and transfer it to actually a much bigger, more exciting space to me, which was women's health. And so I left there to go start this company.
Wow.
Beautiful.
Yeah.
I'm a big fan of career pivots and transformations. So it sounds like you took things from every career that you had and culminated into this beautiful project that's now your business. I love that.
And my kids have all left. This is my 4th baby, I've decided.
Okay.
They've all left the house, and I can channel all of my energy and probably over parenting into Midi.
There you go. So earlier when I said it's a baby, you
Exactly.
hit
It
home
really
for you.
Yes,
So you're an empty nester now as well. Because I'm curious. I have one out right now and one going to be out in 2 years. And I'm wondering, did you just get a new, you're like, I have more time and you just want to go full force and just spend more time there because your kids they don't need you as, they need you,
bored?
But less,
but less. It's just different. Yeah. So.
Honestly, I think starting a career, a company like this in your 50s is the best thing ever because you have so much time, you have a lot of energy, and your kids don't need you as much.
Wow.
And so I do joke that it's my 4th child, and my kids say this is the one that gets the most attention. But they don't need me as much, so it's actually really good timing.
Wow.
Well, I speak on behalf of all the women saying thank you for putting so much attention into your 4th child.
Yes, exactly.
No, it's so needed. And I liked how you used all your knowledge for the company that I think it was Curvos and then to Weight Watchers. And then it's my understanding also through Midi Health, there's also weight management.
Yes.
And so I'm just curious, we talk about menopause, perimenopause, but you also have a lot of different things that you provide women. And I believe weight loss is another thing. I would just like to know all the things that you provide. That would be great so everybody knows.
So we did this pilot. It was actually fascinating. When we first started, we did a pilot with 150 women.
Okay.
And we thought we were a menopause company. Like that was the idea. We were starting a menopause company. And what we found is that women don't have a place to go for all of the things that are happening to their bodies. And it became very clear that menopause is deeply related to every part of our body. So you might be experiencing weight gain. That's menopausal weight gain, right? And 85% of the women who were coming to us were saying, I have gained weight. Right. I don't feel good about my body. Can you help me with that? And so we wanted to help with that, right? We had women coming and saying, my skin is not right anymore. My hair is not right. I don't have as much energy. I'm feeling angry. Like, it's all connected. Yeah. It's really important to understand it's all connected.
Yeah, brain fog.
Forgetfulness, brain fog.
Also, like sex. Also, that's another challenging thing.
Right. Losing your drive.
Yeah. Or dryness and drive. Yeah. Double D on that.
All those. Right. No, that's right. It's all connected.
It is.
And so what we learned is that we had to be women's health experts. No. We were not going to be expert in just one thing. We had to be women's health experts. And so we train our pediatricians, we joke when we call them that, but we train them on all aspects of women's health. And you can't take weight out of it. Women are deeply connected to their weight, and it helps having a weight that you feel comfortable with, whatever weight you want, is very intricately related to your mental health, to your physical health. And so it is all of one part, and we think it's important to treat like that.
Amen. Yeah. Amen.
And since you're treating all these different, feelings that women have or what they're trying to work on, is there one that's more than the other? I mean, you have all the data. I'm just curious what you're seeing from your lens as a company that women tend to skew on this side of what they're looking for a solution. Yeah. What's the variety of different outcomes that you're seeing with help?
Yeah. So I would say, I mean, the number one reason people come to us is probably sleep, actually. Sleep is a really big one. Yeah. Sleep is very big. Brain fog, anxiety is another very big one. People are willing to deal with the hot flashes. It's interesting. They have the hot flashes, but they don't often come because it seems like they're willing to deal with that. They're less able to deal with the other things that are impacting their lives. And they start realizing they don't need to be waking up every night in the middle of the night, or, waking up covered with sweat every night, which was something that was happening to me. So that's a big one. I mean, weight is is a big one. The sexual health thing is super interesting. When we advertise sexual health, people don't come.
Why? Is there a stigma, or is that something you don't want to talk about, or it's embarrassing?
We've been trying to figure it out.
Okay.
But on a second or third visit, everyone wants to talk about it. So it's just not the number one reason that they're coming. But after they have gotten some other treatment, then they're like, can we talk about my libido? Can we talk about painful sex? Many women haven't had sex for many years.
I have a friend, so I'm guilty on the third visit. I talked about it, so you're right. I eventually talked about it, and I was like, oh my gosh, this is a game changer. But I have a friend, it's just, she hasn't had sex like in like a year or something.
So it's very normal.
And I was like, really? And so I told her about Midi Health, and I told her about the vaginal cream, which I think you heard you could also put it on your
face. We'll talk about that. Yes, we should talk about that.
Yeah, I would like to hear about, but I think this is how you can change your life, and it helps with your mental health and all the things. So, it's something that I didn't think I would talk about or want to use, but once I had that conversation, they made it so easy. And what was great is I felt comfortable to have that conversation because it was the same person. Yeah. And I thought that's what's great about all the providers of who you're working with. It's not that you just have a contractor nurse or something. Like, I had the same person. It was a relationship that was actually built.
Yeah.
Right.
To then be able to feel comfortable.
Makes sense. It's an intimate thing to talk about. So you want someone that you have built that with, where you can open up and be in a comfortable space, right?
Yeah.
That's I'm not just going to go to some person on the street and be like, hey, so it hurts to have sex or whatever. You want to have a conversation.
But also
first.
when that happens, women don't realize that this is just related to perimenopause, right? So if you go look at the searches, you read a lot about divorce, right? And you read a lot about, the emotional relationship challenges that people are having. And they don't know that it's actually, well, I will say, I'm going to tell you, I joke that I can't make your husband attractive. And, I can't.
You sure? No, my husband's attractive.
I'm just saying I can't make him nice, but I can make him not hurt. Yeah. And I can also make it so that you have more interest. And that is a big first step. And a lot of women don't know that. And they don't know that. I mean, a lot of them come to us and they haven't had sex for a long time because it just hurts. And so knowing that it doesn't have to hurt is a really big thing.
Yeah. And I'm sure they don't want it to hurt, right? They're like, I want this, but it just doesn't feel great anymore. And why?
Right.
Yeah. And intimacy is really important in a relationship.
Right.
Too, so
Yeah, that's right. I get notes pretty much every day now on LinkedIn from men saying, can you talk to my wife? How do I get my wife to go to Midi?
on LinkedIn.
It's great.
That's fabulous. You know, that's what's great is that men want to have this conversation too and learn, which is fabulous.
Right.
Yeah.
Exactly.
Caring husbands to want their wife to have like something that can help them with whatever they're going through. Right?
Exactly. It's really important.
I wonder, I mean, maybe it's the future, but would you ever merge into men's health at all? Or would that
I think right now, so it's a secret that men come to us for weight loss.
Really?
We don't advertise it, but it's usually a wife who says to their husband, can you go talk to them about weight loss? So we do take care of men, but it's not our core competency.
Okay.
Yeah.
Wow. Okay.
But you're not going to turn them away.
You're not
right?
gonna turn them
We're
away.
not going to
for
turn them
help.
away. Exactly.
Yeah. And
Right.
you just want to help people.
Yes, exactly.
I have a random question of the day for you.
Yeah.
What does MIDI stand for? How
Middle.
did you come up with that?
Like midlife.
Midlife. Okay.
Yeah.
Okay.
I like it.
Nice.
Yeah.
Yeah. Welcome to midlife. Yes.
Exactly.
Yeah. Thank you.
Yeah.
So I want to also talk about the business side of who are the nurse practitioners and how you're running the actual business side of it so that people, because I think telehealth can be sometimes scary for some people or they're used to it in a certain way. So go see the doctor, be in a facility. So now telehealth, doing it online and then also getting a prescription. How has that emerged to build the trust for people to come to Midi Health and get the help? And then also, who are your people that are actually providing these recommendations and what kind of background do they have?
Yeah. So nurse practitioners are probably the best kept secret. Nurse practitioners are extremely well trained. They have to go through a long educational process, a lot of credentialing. They are extremely knowledgeable about healthcare. And then what we do is we hire experienced nurse practitioners. They already have years of education and work experience. And then we train them with Midi University, which takes a long time. So we make them go through a very intensive training process before they see any patients. And then what we do also is we record every visit and then we run it through an AI checker to make sure that the care was extremely high quality. So I think I believe our quality of care is just as good as you would get at any academic medical institution with the top doctors, if not better, quite honestly, because we have people reviewing the charts, we have people creating the protocols, we have all of the information that is constantly changing in the world. We're able to put all of that into our care protocols and update our care protocols. Wow. So I think our care is better than you would get really any place else. I'm incredibly proud of that. When you think about it, most doctors are dealing with so many different things each day that they can't keep track of all of the new research out there, all of the new data. We're able to pull all of that data, all the research, and integrate it into our care protocols, and then make sure that everyone gets access to that information. So I actually feel like our care using nurse practitioners is better than any place else.
Wow. I mean, my sister's a nurse for 25 plus years over at El Camino Hospital. And also just having babies, which I know you do too, is like, they do most of the work. I feel like I'm working with the nurse and they're so educated. And to your point, it's like, I feel a lot of trust. For sure. And I know the credentialing that my sister went through. I'm like, oh my goodness, like you on the verge of like, could you be a doctor or not? I mean, it's intense.
And there's always so much to learn, right? So how you're saying if they take a call and it's not up to the standards, do you then invest in that person to try to help them learn more? And
that's right. Because we record every visit, we can actually see and to ensure really high quality care.
Great.
What have been some of the challenges that you growing this business on both sides of the provider and also the customer? What are some of the challenges that you've seen?
So this is an operational challenge, right? This company is an operational challenge. Hiring nurse practitioners, getting them on the insurance contracts, getting those insurance contracts, credentializing them in each state, and then making sure we follow the regulations for all 50 states. And scaling that is a huge operational challenge. It is not hard per se. It is just a very operationally intensive business. And so that is the hardest part. The nice part is that the demand is there. There's A lot of people who need this care, a lot of women who need this care. So I don't have to worry so much about whether there's demand. It's more, can I offer, I really feel strongly that my most important thing is that we offer the highest quality of care to every woman who comes to us. That is my promise. That is our intention. And that's hard. And so we don't get it always right. So we're working really hard to get it right. And we are, actually, our care, I think, is always right. But we do have operational challenges we need to manage.
Yeah. And are you able to keep up with the demand then? Do you have enough nurse practitioners? Or, I mean, do you have to turn people away? I'm just, because I've heard about that as well. It's like, hey, there's a shortage of nurses and such. Yeah.
So it's not so much, it just takes a really long time for everyone that we're training to get onto our platform. We do a lot of training before they can get on the platform. So we're scaling as fast as we can. But sometimes you don't get in as fast as you would like because it takes us a while to get you in. But it does mean that once you get in, we'll give you really high quality care.
Wow.
So if you're a patient in Nebraska, for example, do you see a nurse practitioner based in Nebraska?
They don't have to be based there. They just have to be licensed there.
Okay.
So we can get our nurse practitioners licensed in multiple states.
Oh, really?
Yeah.
Oh, wow. Interesting. I didn't know that. That's helpful. And then that's a way that you can scale and one to many. And that's probably good for them on the career side as a nurse. So that's actually an interesting question. If there's a nurse out there, like, hey, I want to do, because I could see you're going to the hospital every single day. The work-life balance that's then created in a new telehealth way is probably phenomenal, or a different thing that they can have. I mean, if you're a nurse out there, what does it look like, or what's that turnaround time for them to maybe get on your platform, and what would that look like?
Yeah, honestly, it's one of the things I think I'm most proud of is that we're trying to create a really good career path for nurse practitioners and make sure that they have advancement opportunities, make sure they have a flexible work schedule. Yeah. Most of them are moms or caregivers to their parents. Being able to work from home is really special for them. Yeah. Almost no telehealth companies offer longitudinal care. So there are other companies that just offer one-off visits, but we're the only one out there that's doing longitudinal care, and that's really important. So our job is to offer a really great work environment and workplace for the nurse practitioners so that they want to come work for us. And I think about that all the time because that is really important. It's a two-sided marketplace, right? We have to have great nurse practitioners providing the care, great doctors on our platform, and then the patients. And we know that if our nurse practitioners are happy and treated well and given a great job, they'll do a great job for our patients. Yep.
And I love it that you describe it as a marketplace on both sides, because one of the things when I worked at LinkedIn, I worked on the job side of LinkedIn, and we were focusing on nurses. And the most important thing that they wanted to know was proximity to their, because a lot of them are working moms. Right. It's like, how close is this job to my home? Right. So then I can imagine something like what you're doing. It's like, you can work from home. Exactly. I mean, it makes sense in so many ways. And I just saw that demand go up and up for that job category for sure.
Right.
Yeah. Jeez.
And I'm sure flexible schedules, like if they can only work X number of days a week, you take them, and as long as they're providing that standard of care.
Right.
Wonderful.
So you touched on this a little bit on how you get so much data and on the tech side, but can we elaborate? I'm just thinking with AI, you have all these medical records. Like, what have you seen transformed in this way where you feel like things are advancing, or it's actually helping you accelerate more in this industry?
So I am very excited about our data. So we are now taking care of more women than anyone in the world for menopause and perimenopause.
Really?
Yeah.
How many women are that?
Hundreds of thousands.
Oh, wow. Okay.
So
congratulations.
In 3 years.
Woo, wow.
Yeah. So we're taking care of over 20,000 women a week right now. Wow. And so we have more data than anyone. And so we have the understanding of what works, what doesn't work, what are the different factors for each patient to make it so that it works or not. And there's a lot that we can do with that data that I'm very excited about. One is that we are scouring the universe for new research. And when new research comes out that says, this might be related to a thyroid issue as opposed to a hormone issue, for example, or there's a lot of different things that come out all the time about new research. Now we can proactively reach out to patients and say to them, there's new research that shows that there's a drug that could really benefit you. You should come talk to us about this drug, right? So maybe you're a woman who has breast cancer. You're unable to take hormones. You're taking a supplement. There's a new drug coming out that is particularly good for women who have breast cancer. We can email them and say, we have a drug that you should come try. So I'm very excited about all the data that we're collecting and the ability to do research and over time do really personalized medicine for these women because we will understand them better than anyone else. Yeah. We're also going to launch an at-home blood test. So you can see I have a
was wondering.
Yeah. So we have found a really easy to use at-home blood test.
Wow.
And it doesn't hurt at all, not one bit. And you literally put it on your arm. It collects the blood. You send it in. And then the results come back to you a week later with all the information that you need. Wow. And so, I don't know about you, but going to LabCorp Quest.
I don't go because it's just time out of my day.
Right. It's time out of your day. And also if you had to fast the night before, and then they say, we can give you a 1 p.m. visit. Wait a second, I can't eat until 1 o'clock. So I woke up this morning, I got out of bed, I went downstairs, drank a glass of water, did the blood test. It took 5 minutes, sent it in. And so now we can help you. Number one, we'll have the blood information, right? Yeah. But then we can help you to optimize, right? So we can then get those blood tests every 4 months, look at what's changed in your body, and then help you to optimize. And then we'll be able to see, did you take a supplement? Did that help? Did you take a medication? Did that help? So this is going to be real personalized medicine. Wow. So I am extremely excited about the opportunity to use personalized medicine to make an impact.
Gosh, I love this so much because you're talking about really proactive health rather than reactive health. And I feel like we always go, I'm feeling something now, take care of me. But now you're like, let's get the data ahead of time and let's figure out, and then you have the data. So you can bring all that together and then really talk about proactive health. Now, the fact that you have a blood test, I mean, I'm not going to name any companies, but I remember like many years ago, like people were trying to solve this. So how are you able to do this now compared to when it's been attempted in the past?
So the blood test, there's a collection device that goes on your arm. It's not just one drop like the other company. It's a little bit more than a drop.
Okay.
I took 3 vials. They were each about this big.
So is there a needle?
There's no needle. It's a suction. I wish I had it. I could show you.
Yeah.
It's a little
suction.
We
should have done that live.
I know. We should have. It's a little suction that goes on your arm.
Wow.
It didn't hurt at all. Not one bit. I mean, literally not one bit. You wouldn't believe when you see that I made a video of my doing it. I'm shocked how not it hurt. It didn't hurt at all. I put it on. The blood comes out, and I send it away.
And you got
so
3
great.
little tiny vials?
I got 3 little tiny vials.
Is that the standard, or would there be more
This
vials?
is the most you would need is the 3. Some people only need 1.
Wow.
I got the full 60 biomarkers in these 3 little vials.
Wow. Oh, my goodness.
And so I think this is going to be groundbreaking.
No, this is groundbreaking.
Yeah.
I mean, and so then when you get the blood, sorry, I'm an engineer. I'm going to engineer the crap out of it. So then what do you do after that? Like who's actually looking at the blood?
So there's a lab in Florida.
So you go to LabQuest, or do you use
No, they have their own lab in Florida. We're going to be working with a special lab. Yeah, we have a partner lab that we're working with. We can then customize the blood test that we want. So you'll be able to choose a hormone test or a different kind of panel. And you can get your own test at home. It's very exciting.
Oh my gosh.
You can request what you want tested as well. Like, I want all the tests ever invented.
Yeah, I don't know how many people want that. That's going to be a lot of tubes.
Okay.
You're like, I don't know what's going to be left of you. Yeah.
Exactly. I don't know how many tubes you're going to want, but if you want all the tests ever invented, I'm sure we could give that to you.
Cool. And does it have to stay at a certain temperature with
they
blood?
give you,
how do you,
I wish I had brought it. They give you an ice pack.
Okay.
So you just send it back to them with an ice pack.
Like FedEx?
And FedEx. Yeah.
No courier has to come and pick it up.
They're just FedEx.
Wow.
It's great.
FedExing your blood wow.
It's great. I'm so excited.
Yeah.
So when can we try this out? And then also, of course, then I think about privacy and your blood. I mean, that's a lot of your data and your information. How do
we're HIPAA compliant. We have a lot of privacy. So we're I will say, I don't know if I can say this on your podcast. My husband was joking from me from the very beginning. He's like, you need a lot of security because Midi is going to have all of your friends' vagina information.
Yeah.
He's like,
oh gosh.
He's like, remember that. It's going to have all of your friends' vagina information.
No, it's true.
And so you better make sure you have really good security.
If we're going to send you our vagina information, you better take care of us.
Exactly.
But that's a lot of trust.
It's for the sake of women's health, so I think it's okay.
No, but we do care deeply. I want to say, I care a lot about making sure we have really good security in place.
Yeah, you have to. Wow.
Right.
So when is this available? Is this something new?
It'll come out by November.
By November.
Yeah.
Okay. Awesome.
Nice. And is this going to be also covered through insurance? Or is
this will
be
not
elective?
be covered by insurance. This will be elective.
More elective.
Yeah.
But
right.
okay, so let's talk about things that are covered for insurance or not. Is this something that's going to be expensive? Is it affordable?
No, it's cheap.
It's cheap. Like,
Yeah.
what's an idea for cheap?
We'll find out, but it'll be
find
less
out.
than $200.
Oh, okay, that's not bad.
Yeah.
Yeah, I would do that. And then proactive health. So what, I guess, give us an example of maybe in your early findings, like you just did it. You don't have to tell us your whole medical record or anything like that, but what kind of things will someone be able to find out? Because I've also heard some people even have their diet based on their blood type. That's another thing. But then, yeah, you'll see these deficiencies, like maybe it's like, you got a B12 deficiency. I'm just wondering, like, what kind of information are you going to
Vitamin D
get?
deficiency.
Vitamin D. Okay.
That's a big one that we'll
Like your
be able
normal
to
blood
see.
panel?
Yeah, we can get all that. Yeah.
I'm still like, wow.
I know, it's exciting.
It's very exciting.
And your numbers are so impressive, but the fact that you have the personalization that goes along with it, it's amazing. And that you try to visit within 1 to 2 weeks. You book visits for 20,000 patients every week.
We do.
That's so wild.
Yeah.
Congratulations.
Thank you.
Kudos.
It's amazing. It's amazing. And I love that you can take potentially this blood test multiple times. Like, I think sometimes people take a blood test once a year, and then some people are like, oh, I know, I was thinking, oh, I went on vacation. I was really bad. I shouldn't take my blood test yet. I should take it maybe 3 months later when I'm all healthy, everything's good. But I think you should have those markers every time when you're like, you're doing good, so just your lifestyle goes up and down. So where is it and where's an accurate reading?
Yeah,
So,
exactly.
wow.
Don't wait for the pasta to be out of your
I
system.
know. I was like, I just came back from a trip from Mexico City and I ate a lot and drank a lot. I don't want to do a test, but
I learned an amazing thing about pasta as an aside. If you make the pasta cold and then you eat it, it's much better for you.
Oh.
So it turns out it changes the gluten in the pasta and how fast it absorbs in your body.
Really?
And so if you make it cold, you can then reheat it or not. But cold pasta is much better for you than hot pasta.
Like you just soak it.
Just put it in the refrigerator for a while.
chill it.
After you
Chill it.
boiled it.
Yeah.
Wow.
I don't cook. You called me out right there without meaning to. But so
Yeah,
you boil
chill
it
it.
like normal, then you chill it. And then,
chill it.
Or
okay,
maybe there's
got
some,
it.
like the Japanese, they have a lot of cold dishes too,
Yeah.
like all the soba noodles,
Right.
and a lot of it is cold.
It's much better for you.
I think they're onto something.
Yeah.
Wow. So I love the idea. I used to try one of those diabetes sensors for my glucose and things. So it's interesting now. You'll be able to fast. You'll be able to get that information. Maybe you tie these different things together. Are you able to prescribe some of those? Because sometimes
Everything.
it used to be prescribed. Then you can go,
You don't need it prescribed.
You don't
right?
need it anymore.
Now you can get
Okay.
a device. You can get the CGM without a prescription.
but then it tends to be a little bit more expensive
Right.
too. Yeah. Okay.
So you brought up proactive healthcare. So I have a question for you. I personally am 37. I would like to get a mammogram early just for peace of mind more than anything. I don't have a medical history, all that stuff in my family, but I just want to do it. But they say you can't do that until you're 40. Is that something that I could come to Midi Health and help get a referral?
Yes.
Even if I need to pay out of pocket and all that, but it's an option?
Yes.
Okay.
Absolutely. Yes.
I will talk to you soon.
Yeah.
I know.
It's a great idea, actually.
I think
honestly.
it's a really good idea.
Yeah.
Because you also, I have, unfortunately, I even had a moment where I met several people that we were interviewing, and it was like half of them had breast cancer.
Yeah.
It's like, and so it just seems earlier now.
Yeah.
Or maybe we're just finding out about it earlier, but the more proactiveness that you can have in your health, you catch it early, then you're good.
Yeah. Exactly.
Yeah.
That's amazing. I also think about colonoscopies. Those are, I've had probably 7 of them or so, but you can do it ahead of time if you get that recommendation or family history also. So
Right.
that's another thing that you can do too.
And DEXA scans. So you're not
DEXA
ready
scan.
for a
What's the
DEXA
DEXA
scan.
scan?
But DEXA scan is for your bone density.
Okay.
And
I haven't done that.
So that is actually, they don't recommend it until 65. But I have to tell you, for me, like once I'm 65, I'm too old to fix it, right? So I actually had a bone density scan because I have a history in my family of osteoporosis. And it showed that I was emerging at osteoporosis at age 51.
Oh, wow.
And so then I was able to put more calcium in my diet, add more vitamin D, do more weightlifting. The hormones help your bones from stop deteriorating. So the data is really helpful. It's good to have data, and then you can know what to do about it. So I do recommend women over 50, particularly if you are slender, that you get a DEXA scan.
Wow. Okay. I need to do that. I haven't done that. So when you go to a Midi Health appointment, these are all, it's almost like a checklist.
Yes.
Like I wanted to
So we have
do
an
this.
age well visit that you can
Okay.
book that just does all this stuff and just gives you all the suggestions on what supplements, what tests, really about how to be proactive about your health.
Nice.
Yeah.
I'm a check boxer, so I would be like, do you have a list of the things we can
Perfect,
talk about?
yeah.
And it's just go
Great.
down the list.
Yeah. I guess also could that be a dangerous thing too, where people are hypochondriacs about some stuff? Like, I wonder if you get different patients, like, I need to see you all the time. And I guess that can also happen, right?
I think there's this biohacking concept that people are, and I think some people could probably go a little overboard. But we don't actually find most of our patients are like that. Most of them just want to be proactive about their health.
Okay. This is going to change the game. I'm excited for my blood test. So anyways.
And it's great to hear that women are wanting to be more proactive about their health now instead of shying away from it because they know there's not that much research. No one cares about women's health as much, right? It's like, no, we want to know. We want to get ahead of the game. We want to live longer.
Exactly.
We want to be badasses for a lot longer. Like, let's do this.
And feel healthy along the way.
Right.
Yeah. And not find out too late before you can't do anything about it. So, Okay, Joanna, we learned so much on this podcast. Thank you. I think everybody's going to get proactive health. I think that's the thing. And you can do it through Midi Health. And I'm so glad your service is available. I also think it also feels like it's like the best kept secret. And so that's why I was really excited for you to be on this podcast. We could just blast it out.
Thank you.
So we're just going to hype you up. I want this for my girlfriends. You know what I mean? I want them to be better at their health and be proactive. And
your daughters as they're growing up.
Yeah.
Right?
And not have it be such an awkward conversation to talk about. So anyways, it's going to be amazing. So one of the things we also like to do at the end of our podcast is if there's any women that you'd like to uplift or do a shout out or celebrate, or, this is your platform, anything that you want to share on a particular individual that, or two sometimes. But.
I will say, so we have amazing doctors working with us, and I'm so grateful to them every day. Dr. Mindy Goldman, for example, is one of the world's experts in survivorship. Wow. So she specializes in taking care of women post-cancer who have menopausal issues, and it's a big deal. And historically, doctors have stopped, they take care of the cancer, and they don't take care of the body after the cancer. Wow. And she is the expert at this, and she cares so deeply about her patients. So historically, women have flown to see her from all over the world to get her advice. And she joined us because she wanted to get her advice out there to the world without women having to fly to see her. And so I'm so grateful to her every day because she really is transforming women's healthcare. And honestly, my chief medical officer, Dr. Kathleen Jordan, same thing. Like, they are so passionate about women's health. And I think everyone needs to be grateful for them.
Wow. Thank you. Well, kudos to them, and keep doing what you're doing.
Thank you.
And we're going to get the word out. And thank you so much, Joanna. I appreciate it.
Oh, this was really fun. Thank you, guys.
And with that,
that's a wrap.
Yay. HumanizeHer would not be possible without the crew behind the scenes. Ash Blodgett, our director and creative producer, for guiding us with expertise, creativity, and passion. Becky Davis, our talented director of photography and creative producer, for bringing our stories to life with stunning visuals. And Kristen West, our director of brand and design, for creating an emotional brand identity. To our listeners, we're on this journey together, and we love hearing how this podcast has helped you. It keeps us going, so please keep sending us your stories to her@humanizeher.com to be featured in upcoming episodes. And if you'd like to help us with this movement, please support by rating and subscribing. Until next time.